Hello students, Instructor Pamela here. I would like to give an overview on the documentations and the documents that you'll be coming across in the healthcare field, especially coders. Now keep in mind, during your educational learning process, you are learning all different specialties and modalities of how to code. But that does not mean that you read or look at every single document within a patient's chart. Okay? Usually in inpatient charts, there can be anywhere from 40 to 1,800 pages. Now, does the coder actually have to look through all of those? No. There are, again, particular and specific documents that you'll be looking for example, in inpatient coding, nursing progress notes, and physician progress notes. Those are the main things that you'll be looking for, as well as the discharge summary and any surgeries on the inpatient stay. And if there was a surgery that was performed and there was a biopsy done, we would also be looking for that pathology report to determine the specimen that was taken from the patient during the surgery. So those are the particular documents that you'll review as an inpatient coder. Now let's say if you're working at a physician's office. Doctors' offices have encounter forms. They create the encounter forms that they'll be using that, again, forms for their specialty. Let's say a nephrologist. Nephrologist, of course, would be taking care of patients with diabetes. So we'll be seeing our E&M codes from your evaluation and management section, your CPT book, as well as any of the ICD-9 codes that the doctor uses on a daily basis. So again, doctors' offices use encounter forms. Also, they will be reviewing any type of laboratory or any type of MRIs or radiography reports that's sent later on if the patient was referred for other tests. But for billing purposes, you'll be reviewing the encounter form, and that's where you'll get your service and your diagnosis code. That's a doctor's office. Now let's say if you're working at a surgery center. If you're working at a surgery center, you'll be utilizing the operative reports. So once the surgery is performed, the doctor dictates the surgery. You will then receive the report and begin to code from there. Also, if there was a biopsy done, you will also code, or you'll have to wait for the laboratory report to determine, let's say, if the specimen was benign or malignant, if it was for a biopsy to determine if the patient had a malignancy or cancer. So those would be the reports as a coder for surgery. So again, depending on the department that you work in and what facilities you're working for is going to determine the different documents you'll be using on a daily basis. So please continue to do a great job with being able to separate that. And a good way to do that is start to ask yourself, what does an encounter form look like? What does an operative report look like? What does a pathology report look like? What does a laboratory report look like? Also, laboratory, again, laboratory is only coded from the actual laboratory facility itself. Same thing with anesthesia. Anesthesia is coded separately when it's for the anesthesiologists themselves, especially for inpatient and outpatient surgeries. The anesthesia is included because surgery is being performed. So again, a lot of these questions you know the answers to because either you've, again, been a patient or you've helped family members throughout their patient care. But just keep in mind that your forms and your documents will vary as you move along your healthcare career. So until next time, Instructor Pamela here. Thank you so much for listening. Until next time, journey well. Bye-bye.